Capitalize for Kids is a unique organization that raises not just money, but actually more providing pro bono services to help mental health agencies streamline and make their processes more effective to, for example, reduce wait times, which we know is a big problem. And Executive Director Angela Simo Brown is on the show with me today to talk about Capitalize for Kids and the work it's doing. Hi, Angela. How are you today?
Hi, Janice. I'm well.
So just before we started the interview, we were chatting about the arts and your background in working in the arts, and I said, "How did you move from the arts to Capitalize for Kids?"
Mm,
And it's because of a family connection for you.
yeah, that's right. Well, I played music, but and I did business, and I thought, well, I have these skills. I worked in the arts a little bit, but then I ended up staying in the arts a lot longer than I planned because I had a brother who was an incredible cellist, very talented musician, and had a lot of mental health challenges. And I realized he was trying to make a go of a string quartet, and he was taking it on tour, and it was really hard for him to manage. So I thought I'm gonna really focus on this, and I became an artist representative where I managed his string quartet and I managed a bunch of other musicians. And I just realized I learned a lot through spending so much time with my brother, how hard it is doing your job that you really care about when you're dealing with pretty severe mental health issues. And at the time, I don't think we understood just how serious it was. It ended up that, he ended up having a diagnosis of schizophrenia, and then he ended up developing substance abuse and addictions because he was self-medicating. And, we toured all around North America, and he was this incredible show person. But then behind the scenes, backstage and on the tour, you could see it just wasn't working. And it was just a very, very difficult time in my life. But I would say that moved me to really want to take my skills in business. And when this job came up at Capitalize for Kids, it's a charity, but I realized I know how to do a lot of this work. I can help mobilize an organization that could help a lot of young people like my brother. And that's really why I'm here. I think Capitalize for Kids is doing something so powerful and so unique. So I feel really lucky to have this job.
Yeah, and you are bringing great skills and great background because it's all about advocacy, right? I mean, we have to start with advocacy if we're ever going to get anywhere with treatments and not just medical treatments and improving diagnostics and so on, but wait lists and those kinds of things. So we're going to talk about that, and obviously Capitalize for Kids focuses on kids. And when you go to the homepage of your website, the first thing you see is 1.2 million children are living with some sort of mental health struggle. I'm just going to read these. One in five, only one in five, get treatment. And that means that in Ontario alone, that's 30,000 kids, and they're waiting up to 2.5 years.
Mm-hmm.
So imagine you're a 10-year-old or a 12-year-old and you've waited 2.5 years. Now you're 15 and you are in the midst of the most important time of your growth.
Yeah, and so that's what we experienced with my brother. And I also have a nephew who also struggles with mental health, and he's now 26. And when he was 15, it's when all the symptoms started showing. But we look back and realize there were things we saw when he was 6, 7, 8, if we could have just addressed it then. And that's where Capitalize for Kids is really helping to elevate the sector to help all those kids and families get off those wait lists. We've implemented systems that have removed wait lists by 80%. We're really making service accessible to people. And I would say it's the most vulnerable people that are really suffering. It's the people that can't afford that private care. There are a lot of people out there that, it's still expensive to them, but they can afford it. They can afford the 250 an hour for the psychologist. But a lot of these young people, it's complex. What we're seeing, and I'm not a clinician, I should say that. And the Capitalize for Kids, none of us are clinicians. We're consultants that specialize in healthcare, and we go into these organizations and ask the clinicians and the therapists, what are your problems? And we literally solve the problems for them so they can remove their wait lists. And then we give them funding so that they can make it even better and see more kids. So that's kind of high level what we do. But we've learned that the complexity and the severity of the youth mental health crisis is continuing to worsen. And that's the thing that really is concerning. There's more layers, there are multiple mental health issues, but the number of young people that are presenting also now with substance challenges, concurrent addictions, it just adds a lot more complexity to the treatment. So we want to get to these young people as early as possible. And we've actually started a program with a couple of organizations in Toronto that actually work with toddlers and babies. Now
Wow.
the recommendation is start as young as you can, as soon as you can see anything. You know something's happened, traumatic events happen in the family, or parents are looking for help. Maybe there's things you can do when you have a 2-year-old that can prevent something to really not be dealt with and then become a bigger issue when they're 15. There's so many great things happening in the child youth mental health sector. And that's the optimism I want to say to everyone listening.
Before we move to what Capitalize for Kids does and how you provide the services, I just want to comment on that. I interviewed a child psychologist a number of years ago about childhood grief. And I said, well, at what point in time should you, say, for example, take a child to their grandparents' funeral? And she said, as an infant, because we need to understand that infants experience the impact of loss,
Yeah.
but they can't talk about it,
And they
right?
don't express it either. There's
Hmm.
no well cues that what they're
Hmm.
experiencing.
So
Hmm.
Capitalize for Kids takes, you sort of alluded to, you take a different approach to supporting mental health organizations. So you've brought together and continue to bring together corporations and businesses who have expertise in, as you said, streamlining services.
Yeah.
And help that helps with wait times and so on. So funding does come, but initially the big impact is helping agencies who
Mhm.
do not have these skills
Right.
to do this, and it's pro bono.
Right.
So what
Exactly.
does that mean, streamlining services?
Oh, it's more exciting than that. I know it. What does it mean? It means that think about you're a clinician. You've gone into this career because all you want to do is help kids and families, and then you start doing your job and realize half of your day is writing reports, or half of your day is doing mundane administrative things that are really not what you took this job to do. And you see this wait list and you're frustrated and you want to make a difference and you just don't know how to deal. And it's not your fault. You're not maybe a technology adopter. You don't know what kind of electronics health record system could help you. Maybe you don't know how to use data. So that's what we do. We go in, we say, don't worry. What are the issues you're trying to resolve? And we work on multiple levels. The first thing is usually we just try to get some efficiency in place. And then we help them build a digital infrastructure. We'll pay for that. They'll have electronic health record systems. We often pay for that. We help them learn how to use data to track and to have better measurement of progress and that they can share with a family and they share with a young person. So often, young people don't have any sense of their progress, and it's not always going to be linear. But this new program we're working on called measurement-based care is amazing. After every session, the young person gets on their iPad and they fill out a survey about how they're progressing. There's several studies that show that this improves reduction of symptoms by over 40%, this program, and it really shortens treatment time. So we'll implement these innovative programs after we've made sure we've gotten the efficiencies in place and the infrastructure. And then we make sure that the therapists are trained on the programs, and we make sure that that it's just become part of their normal everyday. So we're kind of there from the beginning right through to the end, and then we help them evaluate and hone it over time. We work with so in Ontario, there's 220 child and youth mental health organizations that are all covered by OHIP. And they are amazing. These people that work there are superheroes. And if we can help them see more children and families, that's all we want to do. Our work helps them see 250,000 kids and families every year. So that's where we get our satisfaction is we know we've removed those wait lists, we've improved the services and the treatment programs available to young people. And our goal is to elevate the entire sector so they don't need us anymore.
Right.
uh, we want to work our way out of a job. I would say after we help the community child youth mental health sector improve their efficiencies and their treatment programs, we want to build the bridges backwards into the hospitals to make sure when people are discharged that they get referred to their local community place, the appropriate place and the appropriate programs. There's so many fragmentation challenges in the Ontario health sector. We know we can fix that. We can create that connectivity.
There's a few things you said there. One that jumps out is the ability of the child to log in and look and see what the results are of appointments that they've had with their psychologist, because very, very stressful because kids don't talk to each other about this stuff. So kids in elementary school, especially, who do not know how to express these kinds of things, but kids in high school aren't necessarily going to say anything to their best friend because they don't understand that maybe their best friend either has a mental health struggle or at least understands and is going to be, I can help you. It's self-stigmatizing.
That's so true.
So, and parents, of course, are overwhelmed because we're still at a stage where parents are dealing with shock that their child might require help. We know ADHD, but what we don't know about are things like OCD. We don't know about eating disorders that much. We don't know how to recognize those, cutting and some severe things like that. But so for the child to be able to go on and read some of the notes that are being written and be able to understand, oh, this is what we talked about. This is what's coming next, and this is what's changed. And I think that that's one of the phenomenal things that you're able to provide.
Yeah, we hear such incredible feedback from the young person about how it engages them. They feel like they're part of it. It builds trust and it builds this partnership with their therapist. And they have an opportunity to be heard, and it's recorded. I'll give you a quote about, like, we talk to people about the need for really better tracking. So there's one of the caregivers, her name is Phyllis. This is her quote: "My grandson has been getting mental health treatment for the past 10 years, but neither of us knew if he was actually getting any better. There's been no evidence that anything was actually working, and we're both tired. It would be so good if there were a way to measure his progress and keep him engaged in treatment. And now with measurement-based care, he's engaged. He knows he has a way to give feedback. He knows that he can track, and it makes us both be energized to go to the appointments." That says a ton right there.
That pretty much says it all, right?
Yeah, and we've all lived it. Like, we've lived
Because
it.
yeah, I mean, you can think about the background, and you can explain to somebody and say, this is how we're going to help, and we're putting in these processes, and you explain that kind of thing, and somebody who doesn't know anything about technology, that's going to go right over their head. But somebody who's bringing their child, or is the child, is going to say, "I don't care. Why are you even telling me this? Don't tell me that my wait list was less because you were able to do that. I don't care what's happening." So part of it is fundraising. So you have corporations that are like I said, providing pro bono services, and you're spreading that across. It's growing and growing and growing. But you also do raise money.
We do.
To help. So once this process is in place, as you said, here's how you keep it going. Because again, right, everybody's under financial stress, and then I'm pretty sure there's no line item in the Ontario health funding that says, oh, and we'll help you keep these processes going.
It's
So,
maybe never say
well,
never.
maybe in the future, maybe in the future.
We
I
are helping government deliver against their mandate.
Yeah,
So
yeah. Well, I always said during COVID, there was so much awareness and so many people said, let's keep this going. We need this. And I always said, oh, I hope that happens. But I'm not really confident because once people go back to their life and, if you've experienced a lot of anxiety, for example, and now you're back to your life, your kids are back at school, your anxiety level naturally is going to drop. And then other stuff comes in. I'm not blaming anybody who didn't keep up the pressure because other things come back in your life and you have to deal with those. But you do some fundraising, and one of the ones I want to talk about are the Bay Street Games
mm,
because the first time I saw it, I thought, oh, they're running down Bay Street. And and I thought, oh, another group running down Bay Street, wrecking the
yeah.
traffic for a weekend. But that's not exactly how it works.
No, it's for the last 13 years, we've rented Varsity Stadium at University of Toronto, and we have about 600 people on the field in teams competing in a fairly challenging physical CrossFit type competition. It's not for the faint of heart, but you don't have to be crazy fit to compete. You just need a really good spirit. There's 6 people per team, so you can just pick which activities you want to do. But some of them are like box jumping, we do burpees, and then there's the dreaded beep test where you're just running and the beeps eventually get faster and you have to run faster and faster. But it is an absolute hoot. And these are companies that form teams. And the spirit of competition is very intense. There's a trophy. There's definitely a lot of pride that goes with it. And that event is it's our biggest fundraising event, actually. And we're always looking to grow more teams. So anybody who's interested, it's June 4th at Varsity Stadium, and we're looking for teams of 6, and it's about 2 hours of your day. It's really fun.
And does it matter how big the company is? Are you only looking for corporations or can,
You know,
like a mom and pop store join in?
anybody can. Our history has been through people that we knew through corporations on Bay Street, is how it started. But now anybody can form a team. We have lots of organizations, like we have a printing company, and some kids from university drive in from Queens and they do it. There's all sorts of people who just show up and want to play.
Amazing. How much money did you raise last year?
Last year we raised 430,000, and this
Wow.
year we raised 450,000.
Wow.
Mm-hmm.
Well, that goes a long way to the amount of money that you need per year so far to date with the number of organizations you're working with. What are the plans to expand beyond Ontario? Because I know right now it's mostly focused in Ontario.
Yeah, it's funny. We actually have done work in BC and Alberta, and other places, but and they want us. There's a huge opportunity in Calgary. They see what we've done in Ontario, and they want us to go and do measurement-based care there. They want us to bring our program for youth with complex mental health issues out there. We also are creating an expertise in using AI Scribe to really reduce that administrative burden. So we have these kind of proven solutions. I would say when we're ready, it will be Calgary and Edmonton. But right now, we have so much to do in Ontario. Measurement-based care is hot, it's proven, and we're working right now on scaling it. We have 19 organizations that we're scaling measurement-based care with. One of them is actually in Niagara region. It's Pathstone.
Yeah.
They're one of our favorite partners. We've worked with them for years.
I was going to ask you about Pathstone.
Yeah, and I mean, our first project with Pathstone was the first time we ever worked with AI was to use create a triaging tool to help identify, prioritize, because their wait lists are really long. So how do you prioritize? So we did that very successfully, and we did an appointment reminder tool as well that reduced wait lists. But now we're working with Pathstone's one of the early adopters of this amazing measurement-based care that engages youth. And we're working with them on kind of the next iteration of that. Like, how do you hone it and how do you adopt even the latest best practice to make it better? So I really applaud Pathstone because they are really leaning into kind of excellence, and how do they just continue to do the best they can for their community.
Yeah, I've done a lot of work and talked to a lot of people over the years at Pastone because I believe it is one of the foremost children's mental health organizations, probably in the country.
Yeah.
I'm a little bit partial,
Yeah.
but I think I know what you're talking about because I was talking to somebody a while ago and they said, oh, well, we're implementing and we're launching these new systems and it's, a learning curve for people and it's going to reduce wait times. And I thought, oh, that's pretty cool. But again, for me, it's like, yeah, well, that's pretty cool. It wasn't until I talked to you a few weeks ago and we talked about this that I understood really the impact
Yes.
of that ability. Because obviously, I mean, if somebody came to me and said, okay, we're going to streamline your processes, I would say, oh, I don't know exactly what you mean. And in a way, I don't actually care how you do it, but just tell me what's going to happen to me at the end. What's this new process going to spit out to me to make it easier?
Mm-hmm.
Not too many years ago, Pastone didn't have a huge wait list. And I'm going to
Mm-hmm.
assume that some of the other children's mental health care didn't have a huge wait list. And that might partly go to what you were talking about kids not being identified or wanting to identify. And in recent years, it's just exploded the number of kids and families, right? Because they also do family, and you talked about that. It's not just taking your child and dropping them off.
No, it's so important. So the real, I mean, the crisis has been building for years, but obviously COVID really, we saw a gigantic increase in demand. And at the same time, unfortunately, there's a lot of pressure on those therapists and counselors and clinicians. And with all of the circumstances of working in COVID, there are a bunch of reasons, but a lot of people quit their jobs and went into private practice.
Mm-hmm.
Um, and so you see the double whammy of the increase in demand at the same time, the reduction in supply, and the wait list just ballooned. And we haven't really recovered from that. And the demand continues to grow. There's such a crisis for youth mental health right now. All the pressures from various things, social media, climate concerns, global concerns about war and safety and
AI.
employment
AI
concerns.
is huge, right?
There's AI. There's all our young people today have so much to worry about. We all did, but we didn't. I mean, I'm older than they are. We didn't have that deluge of daily information of, hey, Angela, in case you didn't remember, here's all the things you need to worry about. We didn't have that. And now the human brain is not really set up to have that every day. And I think it's really what we're hearing from the clinicians is this constant access to the feed. This information flow is really harming young people.
Well, I can't, yeah, I can't imagine being a teenager right now. And I frequently say there's so many stresses, and you just listed a ton of them, for kids, and anything that makes it easier for children to get the mental health help. And I'm going to harken back to the kids having access to
Mm-hmm.
what the strategies are and what the treatment is and the amazing help that must be for children and for families. And Angela, we have to stop here. So much more we could talk about, but thank you for coming on and talking about Capitalize for Kids. It is amazing. It's, when I first looked at Capitalize for Kids, oh, they're just giving money. It's so much more than that.
Thank you, Janice. I really enjoyed our conversation today.
You can listen to all shows of Life Unscripted on your favorite podcast app or on my website at lifeunscripted.ca.